Hello guys, welcome to our new Instagram Live. Today we're going to be talking with one of our six dolls, Six Doll 6, and we'll be talking about her BBL experience from the very beginning until later on through her recovery, what she did on top of the surgery. Remember, surgery is just a part of it. Recovery is equally important, and she's done an amazing job with her recovery. How are you?
I'm good. How are you?
Doing great. Thanks for joining us. Thanks for sharing your experience with our followers. You're one of our BBL patients. You had your surgery, what was it, July of last year? So it's
Yes,
almost a
July
year,
31st. Yeah.
July 31st. Amazing, amazing. And you've done an amazing job with document everything, putting pictures and sharing your thoughts and your experiences with your followers. So it's been a great thing for other women to sort of follow you and watch you and learn from your experiences. Get you to share with us from a patient's perspective, from your perspective, what was it like going through the whole process from the beginning up until now? So let's start with the very, very beginning. What made you decide to get a BBL?
Well, I've always wanted a more curvy shape, and I was in the gym quite a lot. I was trying to, you know, get a shape that it wasn't realistic to get in the gym. I just felt like I wasn't in my own body. And no
Mhm.
matter what I did, I ate super well, I exercised a lot, and the fat would not budge. So 2 years of that, of constantly feeling like I'm just not myself. Like I did not feel like myself. I did not like wearing tight clothes. I felt like I was just kind of myself was disappearing.
Mhm.
So I just decided to do something about it. And I was like, I'm not gonna stay unhappy for the rest of my life. That's not gonna happen. And I've been working at it, and nothing's working. So that's what made me decide to get a BBL.
Why was it a BBL? Why not just liposuction? Why not just go and get a lipo? So what made you go to the next step of doing lipo and then do the fat transfer?
Because I figured since since we're not, since that fat's getting removed, let's put it in the booty.
Yeah. So that's a nice thing about BBLs is that it's not really just getting rid of the fat, but you take fat from areas where you don't want it and put it
Hmm.
to where you do. So butt is the most common one. The other common one that people always talk about is also breast. Now breasts are different. It is not the same thing, and it will be a completely separate discussion. If you guys have questions about fat transfer to breast, you can ask me separately. We won't go into it in this IG live. We'll just talk about the butt, but that is also a possibility. It's transferring fat to the breast, but we'll stay with the butt itself. So you decided that instead of just getting rid of all the fat and throwing it out, you're gonna transfer it to your bum.
Yes.
How did you know there's such a thing as a BBL?
Oh man, the Kardashians.
Okay, all right, bad
The
question. I should have.
Kardashians.
Yeah,
Lots of Instagram models suddenly becoming very curvy.
yeah. I'd like to take this moment to say thank you to Kim for referring all the patients to us. Our clinic would not be the same without Kardashians. Thank you. So let's talk about the next step. So then you decide you want to go ahead and have BBL, and you've done your research. Where did you look? How did you do your research?
Oh man, I spent a whole year before actually, booking a consult. I spent a whole year researching. I researched doctors. I researched proper post-op care. I was in so many BBL Facebook groups. Um, I was going through pages of Google just to get the appropriate information. And
Mhm.
I feel like it's a big surgery. It's a big thing. It's not something that you just decide to do in 2 seconds, which unfortunately I see a lot of people actually do. And then
Absolutely.
there's
Let's try and interrupt right there. BBLs have a reputation of being dangerous, and they certainly are. Realize this is not a joke. This is a real surgery. You should do your research because BBLs have a high risk of something called fat embolism, and it's a serious complication, potentially fatal complication. So it's not like going to get this is a serious thing. You should do your research. So go on.
yeah, it's a really, really big surgery and a very long recovery. So
Mhm.
that's what I always get like messages like, oh, I just got my BBL. Oh, in 2 weeks, can I go drinking and partying? Oh my God. No.
I'm not sure how many consultations you've had, but what made you or helped you zero in on the surgeon or the clinic that you were sort of looking at?
Well, I was looking at pretty much everywhere, and I've noticed that Yes, there's some good doctors that will suck you dry, but I wanted the smoothest results.
Hmm.
Smooth, even, like consistent results. And
Okay.
with a doctor that is safe. And you know what? It was just luck that you were also in Canada, like not far from me. So I was just like over the moon happy that I found you.
Tell us about the day of surgery. Now, a lot of people that want to go ahead with the surgery are really terrified of the surgery itself and going under. So, do you remember the day of surgery? Can you sort of walk us through what happened when you came into the clinic? What do you remember from the whole process?
Ooh, I was so excited. I was so excited. I trust your team 100%. I've seen the reviews, I've seen the patient testimonies. I was like, let's go. Let's get this done.
Some people are super, super eager. Most people do are a little bit anxious. Like most people, even if they're not
Yeah.
anxious, they come in, they're excited to go. But the moment I walk in, I start taking pictures and do my pre-op markings, they get a little anxious. And the thing that pretty much everybody says is they're afraid of going under. They're not afraid of the surgery, they're afraid of going under. Was that your case? Were you a little concerned about going under?
Just slightly, but I really trusted your team. I mean, if you do the appropriate research on your doctor and you know that he's obviously board certified and 100% safe, you need to do your research.
So people are scared of going under, and um, so sometimes people want to see if the surgery can be done under local anesthesia. People under local anesthesia is probably not a good option. It's too much after it's too big. And don't be scared of going under. Doing procedures under conscious sedation or under a lot of local can also be dangerous. They're not danger free. So, general versus local versus conscious sedation, IV sedation, they all have pros and cons. Now, going back to general anesthesia, which is what we do for our BBL patients, people are scared. They're scared of not waking up. They're scared of anesthesia. But can you can you recall, can you describe the whole process? Do you remember falling asleep, and what do you remember about it, and what do you remember about waking up?
Oh yeah, I remember her putting in the whatever she put in, and then she told me to count backwards, and I did two numbers, and I was gone. It was so fast.
It's
And
it's
then I
it's a
re
pretty, yeah, it's a pretty fast process. People often ask me how long is the surgery, and my answer always is 5 seconds. For you, it's 5 seconds. Close your eyes. Next thing you know, you're gonna waking up. But then when you wake up, what do you remember from waking up? Were you
oh my
uncomfortable? Were
God.
you nauseous? Did you have a lot of pain? What happened there?
I woke up like I had the best sleep of my life. That's how I woke up. I woke up so refreshed,
Hmm.
and for some reason I woke up like I couldn't stop laughing. I don't know why I could stop laughing, but I could not stop laughing. I could hear the nurses talk about ordering Chinese food, and I was like, "Oh my God, I'd kill for Chinese food." I was so not worried about pain or anything. I was in no pain. I was just going on my normal day, like nothing happened.
Hmm. And then what happened afterwards, after you woke up?
After I woke up, I think she checked if I was okay, and then they were checking to see if I could stand, and I could.
Hmm.
And then they told me to sit down in the chair because I was a little drowsy, but I was totally feeling good.
Tell us about the pain after surgery. How was your pain?
I think the pain started to kick in really when those pain meds kind of wore off, and
How long after
it's
surgery was that?
uh, maybe like 12 hours.
So when we do the Brazilian butt lifts, um, we give a lot of give our patient a lot of pain medication. Kind of stays on board, and the anesthetic stays on board. So depends on how long. Everybody's a little bit different. For some people, it wears off quicker. For some people, it can be a shorter time. But after the numbing wears off, we give all our patients pain medications: Percocet, Tylenol, threes. When do you start taking the pills?
When I started feeling the pain. But I tried not to take too many Percocets. I think I took it like twice, and then after I switched to Tylenol.
Yeah. Everybody's got a
But
different pain threshold. So people often ask us, how much pain you have. They ask out of patient who had pain, who had the surgery, and someone will say, well, I was good after 2 days. Some people say I was in a lot of pain for 2 weeks. Everybody's a little bit different. Pain threshold is a little bit different. Um, in general, most people are pretty comfortable. I'm not sure if this was your case, but typically the first 48 hours are the worst when you have most pain. But this is not the kind of pain that keeps you in bed. You can't get up. It's very uncomfortable, and you have to take
yeah,
medication
you
every
feel
four
just
hours
very
regularly.
sore all over, like just like ugh.
When did you stop taking your pain medication?
I stopped pretty quick because I have a really high pain tolerance.
Hmm.
And honestly, it just felt like I was sore from like a big workout. I think 4 days.
4 days? Okay.
Yeah.
Um, so after the surgery is over, first night you stayed overnight. We saw you the next morning, then you left, and then we had you come back at about 1 week. But typically for Brazilian butt patients, I want to stay in touch with our patients every single day. So if you have a BBL with us, I want you to be in touch with our nursing team. Yeah, you guys get a nursing phone number or email, and every day update us how you're feeling. I'm looking out for signs of infection, fever, chill, night sweats. We want you to measure your temperature every single day. I want to be on top of it. That's my number one concern after BBLs.
Hmm.
The risk of infection um, goes away after 2 weeks. If after 2 weeks you had no infection, then you touch done, I'm happy. But during those first 2 weeks, guys, if you're having a BBL with us, please don't disappear. We want to hear from you every single day and just know what's going on. Did we do the same with you?
Oh yeah, you guys were on it. I
Yeah.
love the nurses. Honestly, it was a great experience.
We want to stay in touch. Um, like it's not like the surgery's done and we kick you out and never see you again. We stay in
Hmm.
that. And with you, we're staying in touch. It's almost a year now. We're gonna see our patients for up to a year after surgery. Now, what I want to get into next, and the reason why I wanted to do this IG Live with you, is because you've done an amazing job looking after yourself after surgery. And this is a really important point I want to make right here. As a surgeon, I do my part, I do the surgery, but after surgery, the recovery is important. And in liposuction cases, recovery is 50% of the result. So I do 50% and you do 50%. The 50% that patients do is proper garments, proper massage, and staying healthy and taking care of themselves. And in your situation, you've done an amazing job in massaging yourself, getting all the files and everything. So I would love for you to share with us the steps that went into what you did, how you did, and how you did this. Because honestly, I think one of the reasons why you have such an amazing result is because you've taken an amazing care of yourself after surgery. So please share with us what
Thank
have you done.
you. Thank you. Wow. Well, from the beginning, I've always, for anything that I do, I like to research, research, research. That's just the kind of person that I am. So it was kind of a bit of trial and error because I don't really know what I was doing at the beginning. That's basically it.
Okay. So it's your first time getting a BBL.
Yeah.
How did you figure out that you want to get a faja? How did you get your faja and the massages and took all those? Because we do offer massages to our patients in our clinic, but you're from out of town, so you end up finding somebody closer to you, correct?
Hmm. I found Contour Fajas and I contacted the representative, Shannon. You know her.
Mhm.
She's amazing. And she actually came to me, I think, like 4 or 5 days post-op, and she measured me. And so that I got fitted for, that was my stage 2 that I got fitted for. But before I had bought some fajas for stage 1.
Okay.
So that has like softer material. It's like not as compressing as the stage 2. But I learned a lot from this certain group on Facebook that's run by Time Out Massage. She's
Okay.
honestly absolutely, you should check her out. She's really amazing with her massage techniques, and she just is filled with information and wisdom about surgery and BBLs, liposuction, anything like that.
Mhm.
So I was really just following her guidance.
Okay. Now, when it comes to massages, tell us about your massage routine. What was it like, from early on after surgery and how it progressed up until today? Are you still getting massages, by the way?
No, I am not getting massages, but that's because it's been very chaotic here.
You're probably stuck at home with all the quarantine stuff
Oh,
as well, right?
yeah, that too. That doesn't
That,
help.
yeah.
But
But up until now, you were still getting massages, correct? And this is like
up
month after,
until 5 months, up until 5 months, I was getting massages. Yeah.
yeah, so 5 months after surgery. So it's
Yes.
important to know massages help shape the body and smooth things out. And people develop fibrosis. Fibrosis happens after every liposuction. It's body's natural response to the injury. When you have an injury or a surgical injury, your body creates scar tissue. Your body deposits collagen all over, which is the proliferative phase when it's piling up lots and lots of collagen fibers, and then the collagen fibers tend to clump up, And as they do, they become little lumps and bumps, and you have to massage to smooth them out to get nice, smooth results. So please tell us about your massages. How
Ooh,
how were
how
they
were they?
right? How were they initially after surgery, and how it progressed over time?
Okay, well, I got my massages at Bella Body. They're in
Mhm.
Scarborough. They're absolutely amazing. And she actually planned out the schedule of things that I should do before surgery and after surgery. So I was really thankful for her for that because I felt like organized, like I knew what I was doing. And the first massage, you definitely, first of all, the first massage, you want to go with the full stomach. You don't want to go there like you didn't eat,
Why is that?
because a lot of people faint.
Oh, okay.
Yeah. Um, and you want to bring a bottle of Gatorade for electrolytes for
Okay.
that weak feeling. So I had done all of that, and then I got on the table, and then
Hmm.
she just slightly touched me, and I was like, oh no, this is not gonna be good. And it was rough. I have a very high pain tolerance, and it was rough. I was holding back tears, but it gets better. And this is necessary because after each massage that I got, I felt so much better. I felt like the swelling had decreased. I felt like my pain had decreased. So massages are so important.
Aside from making you look better, they also make you feel better. They do
Yes,
help with the swelling. They sort of help you get on top of the pain because right after surgery, your skin is hypersensitive. Just like everything hurts like crazy. So the more you touch it, it's like a sensitization exercise. The more you touch, the more you massage, the more the pain
exactly.
goes away.
It was rough, but it gets better, guys.
Does. Like I tell my patients, when you start out, if you don't have tears in your eyes, you're not doing it right. So just gentle little touch is not going to do much. Did you
Yeah.
do it on massage as well, or did you just always go for professional massage?
I did home massages too on myself in between massages, and I would actually use this machine. It's called the Wall Hot and Cold Massager, and it was
Okay,
actually really good for the lumps and bumps. So in
okay,
between massages, that thing is amazing. You could get it on Amazon. Super good.
mhm, awesome. So that was the early part, and then sometimes people do the massage for 1 month or so, and they kind of forget, let it go. What made you continue and keep doing this for such a long time?
Honestly, I just love the results. I love the feeling of after. Hyperbaric chambers, they're amazing.
Okay. They
Before
are,
surgery and after.
they are.
Definitely,
So
I think it played a big part in my recovery too.
Um, I do recommend that patients do seek out hyperbaric chamber. I do give a few recommendations around town. There's no scientific evidence to say that it's going to improve fat survival. More than just the fat survival, patients tell me that they feel like $1,000,000 after coming out. You see bruising go away faster. They regain their energy and feel like themselves quicker. So I would describe going to hyperbaric oxygen chambers as almost like doping your recovery. You just like push yourself beyond the regular stations that really recover fast, fast,
Mhm.
fast. It's a great little extra. It is not something we offer in our clinic. You would have to go outside to one of the other facilities, and they do charge you some money for it. But I think it's money well spent
Oh,
to
definitely.
have recovery.
You get swollen absolutely everywhere after surgery, not just your stomach or wherever you got lipo. You get swollen everywhere. My feet were huge the first week. I had a huge baby feet.
Did you gain any weight?
Did I gain? I didn't get on the scale, but it was probably all like fluid, I'm
Yeah, so
guessing.
people do gain weight. Sometimes they ask like, "What happened? Why am I like 10 pounds heavier?" It's all water weight. It's all the swelling, and it does go away over time. But initially, yes, you will be swollen. It's all the fluids. It's just the response to having surgery. People do swell, so that is perfectly normal.
I have a lot of people asking me, like, it's okay to be bloated. Like, it's okay to be swollen. Like, that's the journey.
Yeah,
Your waist is gonna shrink by itself. You just gotta wait. You just gotta keep drinking your water, keep
yeah.
compressing, just keep doing what you're doing.
You've transformed a lot from the initial post-op fix up until now. Was it a slow process? Were there like certain specific times when you like notice a sudden dramatic change, or was it just like a slow, gradual progression to where you're today?
Oh, at around 3 weeks, it's like all the swelling just suddenly disappeared. It was very, it was very exciting.
Hmm.
And my abs started to come in, and I didn't even know I had abs, so that was a surprise. And around week, around like 3, 4 months, that's when really everything's starting to come together. So that's why I tell everyone, just don't look at your body before 3, 4 months.
So let's move on to the next topic, which is the fajas. This, so well, I would call it like shapewear, and I still, um, I put compression garments on our patients, and the purpose of the compression garment right after surgery is to minimize swelling and bruising and kind of
Hmm.
smooth it out. The fajas then over time also help to shape your body. So can you tell us more about your faja experience?
Oof, I went through so many fajas just to find the right one. Um, well, the first stage of fajas is stage one, and it needs to be soft and obviously bigger.
Mhm.
And I measured my hips and I went up a size, and it fit me absolutely perfectly. So I think people should do that.
Okay.
But the second stage is much tighter. It's much tighter. It's uncomfortable. You're going to be uncomfortable throughout this whole journey. You're not going to be comfortable.
Where do you feel the pain?
I felt a lot of pain on my sides and on my stomach, but I
Mhm.
think that's the nerves reconnecting. Yeah.
So after surgery, the nerves have been injured, and as they heal, they start to fire randomly. They're hypersensitive, so you will have all things that needles, electric shocks, itchiness, cold intolerance, heat intolerance, all kinds of different sensations, and you're gonna be in some discomfort. That's all perfectly fine. Now, sometimes it can be too much, or it's not going away fast enough. So speak to your doctor. There's medication we can give you to help numb the what's so-called nerve pain. But going back to your faja, um, how tight do you feel in it? Like how tight should it be? What should people expect?
It shouldn't be tight that you're having difficulty breathing. It should be tight like you can move around.
Hmm.
Like it should feel not snug, but a little tighter than snug. So you need to
Okay.
be able to move around in it, basically. But it shouldn't be cutting off your breathing because that's dangerous. And sometimes there is such thing as overcompressing, which
Yeah.
is a mistake that I did at the beginning. I did too much too fast, and my massage therapist, queen of body sculpting, um, she she told me you're doing too much, and it's gonna slow down your healing. You're doing damage to yourself right now. And she noticed it because my stomach was so much darker than the rest of
Mhm.
my body, which was basically a sign of lack of oxygen.
Um, so what can happen is, yeah, you have to be careful. If you wear a compression garment too tight, it can create indents in your skin that can become permanent. It also create pressure sores. People refer to them as faja burns. It looks like a burn. It's
Mm-hmm.
really a pressure sore for too much compression, but there's too much pressure that is blood supply is not able to get into the skin, and then skin dies, and it looks like a burn. So be careful. You should have some tightness, but if you're uncomfortable, ask somebody or take it up. You should not be in too much discomfort after putting a faja on.
And always wear a tank top under, especially at the beginning, because
Yeah, have
it's gonna help.
some more padding. Yeah.
Yeah.
One common complaint I've heard from a lot of people is they feel like their fajas tend to be very, very tight on the side. Did you feel like your sides, your sort of lateral thighs, lateral butt was being compressed too much?
Not my butt, but my
Hmm.
sides, yes. And I actually bought something to help with it because you can. There's so many accessories out there. You
Okay.
can. They're called lateral protectors, and they're like little foam pads, and you can literally put them on your sides so that it helps with the pain.
But if you add a foam pad, you're adding extra layers, so there'll be more
Hmm.
compression. So wouldn't you feel even tighter after that?
Yeah, it does feel a bit more tight, but it's less painful than the the faja. Oh my God, the faja fabric on you.
So I got a few more questions sort of to finish off. One of them is, why do you think, or what is the secret sauce in this whole process that helped you get this amazing result that you have? What do you think was
Ooh.
the secret that helped
Definitely
you perfect?
combination of obviously doctor and proper post-op care.
Okay.
Definitely invest in your post-op care. A lot of
Okay.
people think that, I'm going to have this surgery and then I'm going to have a few massages and that's it. No, keep going, because
It's a process.
you're only fully healed at a year. So just
Exactly.
keep going.
It's a process. It takes a while. You gotta be patient.
Yeah, it takes so much patience, and you go through a roller coaster of emotions.
Perfect segue, because my next question was about emotions. Um, Pretty much every patient that goes to surgery goes through the roller coaster of emotions, up and down, and it starts right after surgery. I don't know what it is, the concoction of drugs that the anesthesia gives to patients, but some patients wake up super happy and loving me and excited, and some patients wake up uncontrollably crying. They just can't help themselves. They just can't stop crying. And then people go through ups and downs. They feel amazing. They do their surgery, and the next day they feel crappy. They feel like, what am I done? This is horrible. Why have I gone through this? And it's an up and down, up and down. As they're recovering, they're like, oh, I have this, I have that. And people have insecurities. Let's talk about you. Like, I think most people that follow you will say, you look absolutely phenomenal. You are flawless. And yet I know there are some things that you feel insecure about, and you posted about this on Instagram saying, there was something that you just were not happy about. Can you talk about that?
I think we all go through this whole thing. Once you get something fixed, you kind of just nitpick at everything. And that's what I was doing, and I was going through that emotion of roller coasters. Especially around like 3 weeks, around 3 weeks,
Mhm.
because I mean, you're sore, can't do much. You're just filled with padding, so you look like a Michelin man. So yeah, you're gonna feel fat, and yeah, you're gonna feel depressed. But under it, it looks good. It's just you can't see it, so that's why you feel so depressed. But yeah, I guess a lot of people after surgery, once they fix something, they start to nitpick at other things and they want to perfect other things. And surgery is not for perfection, it's about enhancing what you already had.
Exactly. And you realize that you're always your biggest critic. You see things other people don't see, because you stand in front of
Exactly.
a mirror, and if you stand in front of a mirror and look at something and you see a little imperfection, the longer you stare at it, the more it gets growing and growing and becomes humongous. And it's really important that you have people around you that are supportive, because I've seen how good support can make all the difference, and bad support can destroy beautiful results. I've had patients that are super happy, and then months after, some friend or family member reports, like, hey, what is that? And suddenly they see some imperfection that's just killing them, and they just, rush to it, and they say, I need a revision, I need a touch up, this is horrible. And I don't see it. I'm like, that's normal, that's perfect. But in their mind, because of their surroundings and their support cells, become such a big issue, that they just are dying to get in there and get a touch up or revision. So it's important sometimes to step back and say, okay, let's look at the big picture. I look amazing. This is awesome. There's no need for a touch up.
And also remember what you started with. Like,
It
this
is
is like
amazing.
such a crazy enhancement. Like,
It is amazing how people forget. Whenever people say they're unhappy with the result, I pull up their before picture, because I know 9 of 10 times they forgot what they look like, and then they go, "That was good.
yeah.
Wow. Okay, 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 okay. I'm good now.
I actually have a question for you.
Fire away."
Yay. What makes a surgeon decide if they want to use drains or not?
Um, when you think the risk of fluid collection is significant. So I used to never use drains when I did liposuction, but as I became more aggressive and being more and more lipo and creating more of an open space, um, the chance of developing a fluid collection called a seroma goes up. And so I started using drains. If you do a little bit of liposuction and the area that you liposuction then collapses, that's fine. But because of the amount of lipo that we do these days, I leave a lot of empty space underneath the skin. There's a lot of, if you see our snaps, I show this sort of honeycomb meshwork, looks like pizza. Sometimes people say it's empty spaces where fat used to be, and just you see the fibrous tissue. So all this empty space is potential space where fluid can collect. Unless I'm able to compress it with a compression garment, this is going to be empty space that's going to collect fluid. And so you have
Hmm.
to leave in there. Ideally, I wouldn't use drains, but it's just impractical to like squeeze somebody like hell to minimize this. The other reason why I would use drain is if I use an ultrasound like a baser, and if
Hmm.
I'm using plasma. So all of these increase increase the risk of serum fluid collections. And so now, pretty much for all my Lipo 360 and BBLs, I always use drains.
Oh, that's nice to know. Thanks.
All right.
I was getting that question a lot, so I was like, oh, might as well ask the expert himself.
Now, some people don't use drains. What they do is they leave their incisions open and let people drain. And you see these pictures from usually from down south, Colombia or Dominican, whatever.
It looks so brutal.
And they're like massaging and squirting
Yeah.
out. Perfectly fine, but it's an extremely messy thing.
Yes.
So I just want you to have a drain and collecting it a nice little drain. And for our patients especially, all our patients get to stay at the Fairmont Royal Hotel overnight. If I don't put a drain in, it's gonna look like a bloodbath. That's gonna be a disaster.
And even with the drain, you still leak a little, so I can't even imagine without it.
Exactly. It would be a nightmare. I actually had a patient a couple of years ago who called me in the middle of the night saying they're bleeding, they're calling 911, they have to go to the emerge. I'm like, they're probably not bleeding. So I said, well, security was going up there. Like, I asked security, he's probably calm. I said, can you tell me, is there a lot of blood? He's like, yeah, there's a lot of blood. Like,
oh my God.
I still couldn't believe it. So paramedics show up, and I'm like, okay, these are medical people. So I'm going to ask them, is she really bleeding? And the paramedic's like, yeah, there's blood everywhere. All right, all right. So they took her to the emerge. I went to the emerge to meet her there. I walk in, I look at her, I'm like, where's all the blood? There was no blood. What are you talking about? They checked her blood, there was no blood loss. So they checked the patient. She was perfectly fine. We brought her back, and then we went up and see the room. And I think I posted this picture on Instagram. It's a little bit of blood on a pad on the bed, and then she had 2 red pillows. And because everybody was panicking, they all thought these were blood-soaked red pillows, but those were just red pillows.
Oh my God.
So everybody panicked. The blood loss was actually really minimal, but yeah, people get scared and they think they're bleeding to death. And there's a question about medications, anxiety meds. What is maybe a case for me? I guess it's a question on anxiety medication. Guys, if you take medication before any prescription medication, don't stop taking it. If you have questions, ask your surgeon. Continue all your pre-op medications. If you have anxiety, do take your anxiety medication right before so you can sleep. Question about J-plasma. All right, that's a great topic. So J-plasma is this new technology which we've had for about a year. Did we use J-plasma on you? I think we
yes,
used the J-plasma.
yes, you did. Yeah, on
so
my stomach.
J-plasma is a helium plasma that takes helium gas, radio frequency stimulates the gas to go from a gas phase to plasma phase. That's a 4th phase. People talk about solid, liquid, and gas, and there's also plasma phase. The plasma creates thermal injury, thermal change to collagen fibers to constrict them. So it doesn't shrink the skin, doesn't give you skin tightening. It makes the skin heal closer to deeper layers. So what happens is shortly after surgery, when you pinch yourself, it feels like it's really, really stuck down. Now people ask if this is permanent. It is not. Nothing is. If you stay as you are and you don't move, yes, but as you keep moving your body and your skin and all the layers move, they shear and they move. The way I would explain to somebody is it helps to hold the skin in place for the first few months, then it loosens. And as it goes on, people sometimes feel like the effect is gone completely. I would describe it as you loosen up, but you're in a better shape than if you would be had you not done it. I don't know. What was your experience like? You had J-plasma. How long do you feel like your J-plasma lasted, and what did you think about it?
I think it lasted between like 3 and 4 months, and it was really like it's crazy. It felt like my skin was like super tight. It was pretty cool.
I have people describe it as they felt wrapped, like really tight on. But then as you move, it will loosen up. It will loosen up. How many months would you say you felt that the difference lasted? Was it 4 to 6 months, or was it longer?
Yeah, 4 to 6 months.
Okay. Did you have any lumps and bumps under your skin that you had to sort of focus on work on? You remember?
At the beginning, yes. I like towards my lower abdomen, I had a lot of bumps, and my massage therapist just massaged them through, and after a couple sessions, it's completely gone.
Do you have any lumps and bumps left behind?
Super smooth.
There's a question about how do we determine where we go for local anesthesia or general anesthesia. They both have pros and cons. Whenever you can, you would do local anesthesia, but you can't always do local anesthesia. Local anesthesia means that we freeze something and we inject medication, typically called lidocaine or xylocaine. Like any drug, there's such a thing as a toxic dose. You can have too much. So if you inject too much, trying to cover too big of an area, it can actually be toxic to you. So that is the limiting factor. So if it's a small area, we can freeze it, great. If it's a larger area, then I prefer to put you to sleep. It's simpler, easier, and quicker. Typically, I do BBL under general anesthesia. There are people out there that do BBLs under local. Um,
They don't end up looking good at all because they can't you know do what you can do under general anesthesia.
yes, it is difficult to make it completely numb. It takes longer, and you can't be as aggressive. You can't take out as much fat, and then injecting to the butt is a little more difficult. So for those reasons, I personally am not a fan of local BBAs.
Plus, I can't even imagine being awake during my PPL. Oh my God.
There's a question about, is no pain medication common? Um, is it common not to take pain medication afterwards? It's not. Everybody's got a different pain threshold. I have some patients who stop taking the medication, like the strong painkillers, after a day or two, and some people keep asking for refills for weeks. So again, everybody's a little bit different. Um, I find women that had children before and gone through vaginal delivery tend to have a higher pain threshold. People that had previous surgery tend to have a higher pain threshold. Um, and men in general tend to have a much lower pain threshold. Question, what is an alternative to narcotics if you can't have narcotics? There's non-opioid medication for people that can't take narcotics. I've had a patient who I did a breast reconstruction on, and she didn't take anything, like zero. So she had absolutely nothing, and she just meditated in recovery. I was impressed because breast
Wow.
reconstruction
That
is
takes
is
strength. That takes
it's a
strength.
it's a painful surgery, and she did it without it. So mind over matter. Not that I recommend it. That was one patient. I would not want to recommend this to anybody. Um, if you have issues with pain medication, you probably have been seeing a doctor about that. Maybe get a referral to a pain specialist, and maybe we can talk about alternatives, or we can talk to our anesthesia doctors about alternative medications for pain if opioids are not the way to go for you. Question about fat dying. Um, most of the fat that gets injected does not survive. Just the way it is. What percentage of the fat would you say you've retained in your butt?
Mm. It's hard because I feel like it would be a better question to ask someone that sees me every day.
Okay.
Like, because I can't physically just look back and be like, oh, let me see. I want to say maybe like 35%. I feel like it was like really big before.
So, um, right after surgery, your butt is going to be huge. All the volume they've injected, all the fat injected is there, plus there's going to be a lot of swelling.
It's swelling,
Over the next
yeah.
2 to 4 weeks, you're going to lose what seems like a lot of volume. And this is really the water, the swelling. So you're going to lose the swelling. And then over the next 3 months, the fat that did not survive is slowly going to be excreted from your body. So you gotta wait full 3 months to see the final results. Typically 3 months. Some people see results for a longer time. Some people see them like they stop changing after about a month. Now I've had some people message me years after surgery saying that years after they've lost volume in their butt. I'm not quite sure why that is. It's probably just with the fat distribution. As you age, your body fat distribution changes. Typically, it goes from the good places to the bad places, and that may be happening in those patients because I'm not quite sure why years after surgery someone would suddenly lose volume in their butt.
Maybe weight loss.
Um, Weight loss is, the first thing you think of, but sometimes people say I haven't lost any weight, my butt just went away, and it's difficult to say, why that is. Maybe the fat redistributed somewhere else. That being said, fat does not move. Okay, so if sometimes people ask, can my fat move from here to there? So when we do liposuction fat, so what we do is we take fat cells and move them from one place to the other. These fat cells are little containers that hold fat. Because fat doesn't float freely in your body. It's stored in fat cells, and fat cells stay where they are. Now, as you age, or gain or lose weight, fat cells swell up or shrink. They go up and down, but they don't actually move. And as you age, your body, for some reason, this is genetically predetermined, starts depositing fat cells in one area versus another. So this is how fat distribution changes in the body with aging. Pineapple, bromelain, and
Yeah, I had bromelain pills. I still take them to this day because I still have some
bromelain.
swelling, but
You don't want to be eating or drinking salty things. Don't go for sushi. Don't have soy sauce, something high on salt, because
you're
salty
gonna
things.
blow up like a balloon.
Exactly. You're gonna look like Michelin Man.
Ooh.
There's a question about how long did you use a BBL pillow? Did you have a BBL pillow?
I did. I did. I
Okay. How long
started
did you use
using
it?
it. Actually, I used it on my flight going home,
Hmm.
and it's not comfortable. You got to get used to it because it hurts on your thighs because you're basically sitting on your thighs. I don't know if that's makes sense in any way. So you
Okay.
got to get used to it, and it's pretty hard. But once you get used to it, it's I actually brought it everywhere. When I would go to restaurants, I'd bring my pillow. Had some
Okay.
weird looks, but whatever. Still look good.
And when did you stop using a BBL pillow? When did you stop using a BBL pillow, and when did you start actually sitting freely on your bum?
Um, I really because I wanted to do this once. And I know some people they go through numerous rounds because they really want an extreme look. And I was like, I'm doing this once and that is all. And so I wanted the best possible like chance of fat survival. So I waited for like 12 weeks to not
Mhm.
sit. And it was a challenge
Sorry.
and I did it.
There's a question about Vaser. Vaser is ultrasound liposuction. It's not ultrasound liposuction. It's ultrasound used for the first step, where ultrasound creates vibrations to break up fat. I use it typically on thinner patients that have much finer liposuction, people that had previous liposuction, there's fibrotic tissue, or if I'm going to areas which I know are fibrotic, such as brow rolls. If I'm going to focus on brow rolls, Vaser really helps because it's very, very fibrotic. And so again, what Vaser is, it's ultrasound. Sounds like laser, it's not. It's ultrasound. The ultrasonic vibration creates cavitation, air bubbles in the tumescent solution and break up fat. So it's a gentler, less bloody, smoother kind of a result.
Does Vaser help you recover faster? Do you have like a faster recovery time with it?
Um, on one hand, you could say yes because there's supposed to be less bleeding, so there's less bruising. On the other hand, um, it can create more of a seroma, which I find, like I said, for vasers, I use a drain more aggressively. So uh, there's pros and cons. I'll leave it as neutral.
What are your thoughts on ab boards actually?
I think the benefit of the app board, it's actually a great question because they help. After you liposuction the belly, you sort of deflate the abdominal skin, and people have a tendency to slouch. When you slouch, you fold your abdominal skin and you get these horizontal lines. The app board acts like a board that holds you up and kind of almost hyperextension, so you're not slouching and your abdominal skin stays flat. So people that had liposuction in the abdomen and like a skinny layer left behind, definitely I highly recommend the app board. Did you use the app board?
Oh yes, I actually use the Surgeon Made ab board. It's so
Mm-hmm.
comfortable, and it keeps me so flat. It's crazy. It helped me a lot during my recovery.
So skinnier patients, people who have more aggressive liposuction on the belly, definitely recommend that you get just an board. And remember the purpose of this, it's to help you stay straight. So, there's no board that's going to prevent you completely from slouching. It's just
Mm.
to remind you, kind of digs into you. Stay straight, don't slouch because you will get these horizontal lines. Are you allowed to use vibrating massage in the first few weeks? Absolutely. Vibration is good. Um, Best thing always look up somebody who is knowledgeable in post-op lipomassage, so they know what they're doing. Question: is it true that after a couple of lipos you may develop fibrosis, and additional lipo may be hard to perform because of scar tissue? Absolutely. After every lipo, every time you go back, you have more and more fibrotic tissue, and sometimes it may feel soft. It may feel like what's left behind is fat, but once I go in there, I find it becoming really, really hard. I had a patient recently, a couple of months ago, who had what looked like residual fat left behind. So I went in, I tried the liposuction, I could not. It was hard like a rock. It was scar tissue. So we had to abort. Scar tissue, you cannot liposuction. You can potentially cut it out, stretch it out with surgical approach, but not liposuction itself.
What can you do for fibrosis? Is there
massage. Get on it quickly before it becomes solidified. Lots and lots of massage. Once it becomes a hard, solid scalp lump, you can try to melt it or soften it with steroid injections like Kenalog injections. So sometimes it's simply injections, and that's what they're for. Question: is it hard to do the BBL procedure for people with tight skin? So that's a great question. If your butt is tight, if you have a tight skin, understand that no matter how much fat I'm going to inject in there, it's just not going to stretch out. Think of it as a leather bag, and you inject in Jello. You're going to inject lots of Jello until the bag is full. Once it's full, the more Jello you inject, it'll just squirt out. It's just not going to stretch out this really, really tight bag. And I've spoken about this many times before. I've put out some of these little educational videos trying to explain what's happening. You have a muscle layer, then you have the fatty layer, then there's skin. Between the skin and the muscle, it's not just fat, but there's little fibers that are holding things together, and these fibers are really tight. So when they collapse, you can expand this, but once they become tight, you can't expand anymore unless you break them. And if you break them, you can get what's called a blowout, which is a horrible complication. So I try not to do that. So guys, if I haven't had a chance to answer your question, or you have a question for a patient here, please send us a DM and I'll do my best to answer you each. Check out her pictures. You get to see what she posted pictures of before and now, and you see the transformation. And these are real. This is not Photoshop. This is real surgery.
Thank you so much for having me.
Thanks for sharing your experience with us. All right.
Thanks.
Have a good day. Take care.
You too. Bye.
Bye.